Hi there, and welcome to our video on hair transplant surgery. As you might know by now, there are 4 proven ways to regrow hair that's genetically programmed to fall. That's medically with Propecia or ProScar and minoxidil and Diam-35 for ladies, and hair restoration surgery for both men and women. Hair transplant surgery is basically a way of transporting hair from where we have a lot and transferring it to the area where we have least, usually from the back to the top of the head. This skill has been around for about half a century, but really the ability to create natural hairlines has really been with us, that skill, for the last 15 to 20 years, and I have to say primarily through the efforts of Dr. Dal Stow, the founder of the International Hair Restoration Forum, has this been possible. He created this forum so that hair surgeons from around the world could share their techniques and hone all their shared knowledge to create what we now know as the near perfect technique of hair restoration surgery. This skill involves dissecting hair, respecting the anatomy of the follicle, and transporting it to the area of the scalp that's deficient in a direction, in an angle, and in a pattern that creates a natural hairline or a soft hairline, so that no one can tell that the patient has had a hair transplant. Now I'll take you briefly through that skill and discuss the team. The team involves obviously the surgeon and the hair transplant nurse. The nurse's job is to dissect each follicle to its creating the natural follicle that's going to arrive at the recipient side. This skill takes years and years. So on average you'll need at least a 5 to 10 man team to be able to handle large grafts. Thanks to my relationship with Dr. Akaki and his team in Europe, we now have a 9-man team that's able to handle sessions, mega sessions of 3,500 grafts at a single sitting. This team is also the designated trainer for the American Academy of Aesthetic Medicine, and we have been invited regularly to speak at the International Hair Forums thanks to the great lectures of Salome, our chief nurse hair technician. The techniques in hair transplant, broadly speaking, are 2. Follicular unit transplant, or FUT, and follicular unit extraction. So there are 2 ways to do this. Broadly speaking, the strip method, where we take a strip of scalp skin from the back of the head, and the follicular unit extraction, where a handheld device is used to extract each single follicle. Now both techniques have their pros and cons. Some people would rather not have a scar at the back of their head, even though the scalp scar is now very fine, hair grows all over it. Some people would prefer to wear their hair very short or have a buzz cut. That would also veer them towards an FUE procedure, or follicular unit extraction. So in brief, follicular unit extraction is mainly for people with not much donor area hair, who are also candidates for body to scalp hair transplant, whereby we take the grafts from the beard area or sometimes the body area and transplant to the scalp. And those are the sort of patients that would be better candidates for that. The transplant procedure is done under local anesthetic, and most patients will be relieved to know that you mostly sleep through the whole procedure. There is some pre-med prior to the procedure that just relaxes the patient enough. But the patient is essentially not overly sedated. You can be awake through as much of the procedure as you want. Often patients are encouraged to bring their audiovisual equipment with them. And there's some mild post-op analgesia that's prescribed. The next day you come for a shampoo, and if you're from overseas, you're actually fit to travel the next day. In closing, thanks for your attention. I hope this video has given you the information that you'll need in choosing your hair transplant team. Feel free to look at our website at drruban.com for picture galleries and extra information. Take care.